Good morning, everybody, and thank you for tuning in to the latest update about the progress we're making on Arizona's Health Improvement Plan. This is September 17th, 2014. Some of you are watching live, some of you are going to watch this later. We've got probably 15 or 20 slides to go through to give you sort of an update of where we are with the State Health Improvement Plan, and importantly, where you can participate in the coming weeks and months in helping us develop the details that will make the State Health Improvement Plan something that's operational and that we can use for best practice implementation and interventions over the coming years. Those of you that are following online, as I advance the slides, I'll say next slide, or Suzanne will say next slide, and we will go through the details. I forgot to introduce myself. My name's Will Humble. I'm the director for the Arizona Department of Health Services.
And I'm Suzanne Pfister, the co-chair of this, and I'm CEO of St. Luke's Health Initiatives.
So we'll be doing a co-presentation here. Again, so when I say next slide or Suzanne says next slide, go ahead and on the version that you downloaded, go ahead and move to the next slide. So this one is just a presentation overview of what we're going to be going through over the next several minutes. We're going to go through the State Health Improvement Plan process and give a summary of how we've gotten to the place we are today and then where we're going in the coming weeks and months. We're going to go through the flagship goals and priorities that we have developed over the last few weeks with the steering committee and solicit feedback on those flagship goals and priorities. We're going to move to the next steps portion where we're going to talk about where you can get involved in helping to identify strategic priorities and tactics, public health interventions that will help make this an operational and executable document, and then we'll talk a little bit about some links that will provide further information at the end. So go ahead and move to the next slide. So, so why are we engaging in developing a state health improvement plan? Importantly, I think from a global perspective, the important thing about the State Health Improvement Plan is that it provides a set of priorities for the entire state to improve health outcomes in Arizona. It will provide leadership and direction about how we move forward in the coming years, really in the next 5 years, to put together objectives that drive towards those improved public health outcomes. It helps all of us in the healthcare and public health system, and even in other sectors like planning and zoning at cities, et cetera, to align the resources that they have with the goals that we develop and over the coming months in the State Health Improvement Plan, and allow all of us to collectively share and understand those goals and objectives. And so those are the key priorities. Sort of as a side benefit, the State Health Improvement Plan process also helps us to meet national standards for the accreditation of Arizona's public health system. Next slide. So what does the State Health Improvement Plan do? I already mentioned that it really provides a 5-year game plan for all of the partners in Arizona, not just the public health system, but the healthcare system and other stakeholders in cities, zoning, et cetera, to work together to achieve a healthier Arizona. We are prioritizing the leading health issues. That part of it is already done. We are now in the process of defining discrete objectives for each one of those priorities, and then assessing Arizona's capacity to address the issue. And that's really the action component of this. Like I discussed, we know what the key 15 indicators are from the state health assessment. The real key next is to identify ways that we can address those issues using an intersectorial approach, again, not just a public health approach.
And I think it's important to realize health is moving far beyond healthcare. And so what this acknowledges and takes into account that health happens in where we live, work, and play. And you want to take advantage of that in developing a truly healthy environment. It's healthy for our communities as well as healthy for individuals. And so this plan really acknowledges that and looks at it from a broader perspective, which I think is a great way to go in setting up the next 5 years.
Right, yeah, good point. Okay, next slide. Suzanne, take this one.
This is a timeline you'll see, and talking about, we started this earlier in the summer, and now we've had one broadcast before. This is our second broadcast. We did put together a steering committee of community leaders, which we've really designed to serve as ambassadors throughout the state. So we want to make sure everyone is included, and they have been charged with using their networks to get the word out about this and help us develop both the work groups and fine-tune the priorities and the game plan, of which we'll do. So that steering committee has met a couple of times so far. We will continue as this process moves forward to get information out, both using web and social media, as well as through the work groups and through the steering committee. So as you can see on the timeline, we'll have another steering committee to kind of summarize the input we hopefully get from you today, and then look through the work groups, have them set objectives, and look at the state health improvement plan. The goal ideally is to have something finalized by December, but if we need to go longer to get those work groups outlined, we can do that. Next slide. These are the leading health issues that Will referred to, the 15 public health issues. And you can see that we've sort of grouped them by risk factors, by morbidity and mortality. Those are jargon words from a healthcare standpoint, but what diseases or what conditions lead to early death or lead to infirmity, if you will, and then looking at kind of systems of care. So these all came out of the health assessment that the state conducted before. And if you want more details, you can easily go on the ADHS website and get information in detail. There's almost a 400-page document that describes all these and gives very, very rich data by county level and looking at the state as a whole as to where these different conditions and different issues are more prevalent than others. So if you want that level of detail, it is absolutely there through the health assessment. Next slide. The steering committee, again, has met over the last couple of months. We had a June broadcast. We asked people for their input. We had almost over 250 people respond, and we talked about some of the criteria. We were looking at how we might prioritize that criteria. The criterion used to measure those health issues as you could well imagine, it's hard to say, is teenage pregnancy more important than tobacco prevention? So we had to look at how we might prioritize or draft objectives and draft strategies based on those health issues. Next slide. The steps are, we looked at that priority, we got some good sense of that, and the staff at DHS did a great job of putting together issue briefs on all of the health issues. They are very easy to read, good, solid information. So I would encourage you, if you want additional information on any of those health issues, to go on the ADH website to get that information. Because again, they are very helpful, and the work groups that we're putting together will use that information as they're really helping to develop their strategies. Next slide. I think that's you, Will.
Oh,
yes.
Okay. So what are the next steps? The next steps are to put together, well, I shouldn't say next steps. What was the next step? At the last steering committee meeting, which was a few days ago, we worked with a series of stakeholders to develop what we're calling 2 flagship goals for the State Health Improvement Plan. And we'll go through those in a second. But each of those flagship goals will contain 15 of all of the proposed priorities from the state health assessment. So the flagship goals are, you can think of as the overarching goals that we have, and then the proposed priorities are within each of those flagship goals. So it might help to just go through some of those details. So let's go ahead and go to the next slide. So the first flagship goal of two, there's only two flagship goals. The first one is healthy communities. So the idea here is to identify interventions at the community level, at the systems level. It could be at the health sector level. It could be at the city planning level. It could be at a whole host of levels that drive towards interventions to help communities, collective groups of people have better public health outcomes. So these are goals that are community type of goals. The second flagship goal that we identified at the steering committee meeting a couple of weeks ago is really around individual people. So these are interventions at the individual level that we will develop over the coming weeks and months that help people to make better and healthier choices at a granular level. So you can think of these two as community-based interventions and then interventions that are designed to help people make better choices at an individual level.
And this is really an acknowledgement. There's been a lot of national and international research into why people are not as healthy as they used to be, or why do we have higher levels of obesity. And what we've found, and all the research shows, is that almost 90% of people's health is not based on the actual medical care that they get. It is based on how they live, where they work, what aspects from an environmental standpoint, and problems or conditions that they face in where they live or work. And so we really need to, in order to truly build a robust program, you need to be looking at those systems and policy levels really on a community level, and then looking at individuals as well.
Okay, so let's move, good point. So let's move to the next slide. So this slide reviews again those 15 key priorities that we identified in the state health assessment. So remember, the flagship goals that we're proposing are community health and individual health. And then within each of those flagship goals, we will include interventions for all 15 of the bullets that you see here. So everything that was captured in the state health assessment as priorities through either the community health assessments or the state health assessments will be included, but we're going to capture them within each of these two flagship goals around communities and individuals. So let's go to the next slide. So for each of these priorities, again, that will be housed within one of the two flagship goal areas or both, we will be identifying high impact strategies and interventions, evidence-based practices that have been demonstrated to be effective in other jurisdictions across the country. There's a lot of resources that are available from the CDC, the Community Guide for Prevention, et cetera, that we'll be using as idea generating interventions to include within each of these flagship goals. We'll be reviewing existing assets and current gaps within Arizona, and then creating an implementation plan, again, a 5-year implementation plan to actually execute each of the things that we identify throughout the process over the next 2 or 3 months. So going to the next slide, we just wanted to include a couple of examples to sort of capture your attention about what is it that we actually mean by healthy communities and healthy people. So in our first example, which was identified in the state health assessment as a key priority around physical activity nutrition that drives the results of the public health epidemic that we have, not just in Arizona, but across the country regarding obesity, you can think of interventions in 2 different categories. One being healthy communities. In other words, identifying priorities and objectives around helping communities to develop better walking paths so people can make better choices, bike lanes, so that cities can have a diamond lane for zoning farmers markets in communities, community gardens, parks, those kinds of community interventions that help people to make
healthier.
to be healthier, both on the physical activity side and the nutrition side. Another one of our flagship goals is healthy people. So what does that actually mean? Well, that's identifying interventions at the individual level to help people take advantage of the interventions that that we will be are developing now, but will continue to develop in the healthy community objectives, like biking, safe routes to school, biking and walking to school, getting families to make that the habit rather than doing the turnaround all the time. How do we implement interventions to get people to actually get 30 minutes of moderate physical activity a day? What are the things that we can do to get people to actually eat more fruits and vegetables, whole grain foods, etc.? So you can see where we're going when it comes to physical activity, nutrition, around healthy communities and healthy people. Let's move to the next slide around oral health. Again, each of these are, I think we've selected 3 of the 15 key priorities to fit them into the 2 flagship goals. So looking at oral health, you can think of community interventions for oral health. Could be things like encouraging more of Arizona's cities and towns to fluoridate their water, which is a proven, safe and effective way to reduce cavities, not just in kids, but in adults too. So community water fluoridation would be a way of implementing goals at that community level through the flagship goal. Another would be increasing access to care for dental services, both in kids and adults across Arizona. Again, a community type of intervention. At the more granular level, through the Healthy People flagship goal, we'll be looking at strategies to try to get people to actually floss like we're supposed to. Did you, Suzanne, today? I did not. How do you get families to choose dental sealants? How do you get families to make sure that their kids get into the dentist when they still have their primary teeth at age 1 or just coming in? So those are the individual type of interventions that we'll be looking for through that Healthy People objective on the flagship goals. Moving quickly, and we'll go through this fast, is unintentional injuries and accidents. Okay, so what are the kinds of community interventions we could explore and identify in the State Health Improvement Plan? Well, one would be look at the community level, Arizona's trauma system. How is it set up? Is it set up in a way that maximizes resources in the rural parts of the state where we know we have health disparities when it comes to outcomes for injuries and accidents? So looking at for example, the Indian gaming funding that goes to the trauma system. Are we allocating that in the most efficient way at the community level to improve the trauma system effectiveness, especially in the rural parts of the state? Traffic safety laws around primary seatbelts, for example, workplace seatbelt policies around for people who drive for a living. Those are community type of interventions. At the individual level, we could look at injury prevention in the home. One of the biggest causes of home injuries, I think the biggest cause of home injuries is falls. And when you look into the reasons why people fall, we know what they are. Things like floor mats, pets, things like that where there are simple interventions that people can implement in the home to help prevent them from having a bad outcome and falling, especially with seniors. Child car safety seat education, which it's an ongoing priority now, but that's a kind of thing at the individual level that we could explore and include in the State Health Improvement Plan.
All right, I'll take it from here. What we're going to do, as you can see in the next slide, is we've grouped the 15 into a couple of several different groups that we will have work groups working on. So our goal is if you are involved in this or you know of someone that's involved in it, we want to hear from you. We want to be able to document and sort of inventory the work that's already going on in these various areas, because obviously some very good things have been going on. So document what's going on, talk about gaps, and many of you will know where those gaps are, and then to coalesce work groups in these various areas to both categorize that, do the inventory, and then come up with strategies for the next time or as we go forward, to talk about what are the right things to do and what strategies do we need to do over the next 5 years. So next slide is the next steps. We have received survey. We'd like your feedback on the flagship goals and priorities. Then the steering committee will be meeting in October to confirm those goals and look through the work groups. We're going to start putting the work groups together in October, and then December the steering committee will continue to meet, review those recommendations from the work groups. So there's a lot of work that needs to go on in a fairly short period of time, but again, we know that activities are going on with every single one of these issues. So we want to codify that, inventory it, see where the gaps are, and then create strategies to address those gaps. So next slide. So your call to action, where we need your help, is to give us feedback on those flagship goals, the healthy communities, healthy people, and the different priority areas that we've developed. Help us identify the assets and gaps, and then volunteer for a work group or volunteer your friends and colleagues if they have some expertise on that. So please take, if you go online to our SurveyMonkey, you can just answer the short survey to get a sense of, and that will walk you through those gaps and whether you want to volunteer or you know anyone else that might want to volunteer or lend their expertise to the area. So thank you for your time and interest. We hope this has been helpful. And I know we have some questions that we want to get answered. Please feel free, as part of this webinar, we still have a little bit of time to answer some questions that have come in electronically. So Will, you want to take the first question?
Okay, so the first question is, how will you make sure that interventions are tailored to different racial and ethnic backgrounds? So I think there's a couple of ways that we can do that. Number one is to use existing resources with evidence-based practices that other jurisdictions have been using and maybe that have been happening here in Arizona, to make sure that we're leveraging those evidence-based practices to make sure that we're incorporating interventions that really drive to the health disparities that are often related to ethnic differences.
And we'll also go through the health, that's where the health risk assessment, or the health assessment that was originally done really laid out, right, county by county, some of those disparities. So we'll be able to put that filter on as well and say, given the Gila County's efforts, we want to work with the public health community in Gila County and the cities in Gila County to deal with that. But we'll be able to fine-tune the recommendations based on the county and based on the guidance and the data that we achieved and was made evident in the health assessment.
And then a second thing is really that we need participation from you that are watching online to identify yourself and jump in with the work groups, because really another way that we'll be able to identify the kinds of interventions that will really drive effectiveness for different racial and ethnic groups is to get participation from folks in Arizona that are familiar with the kinds of interventions that will really help in those areas. So it's really about getting full participation in the work groups, as well as making sure that we leverage the pre-existing public health documents that identify evidence-based practices that really drive at those characteristics that often result in health disparities.
Okay, a second question. This is a great initiative. Who are members of the steering committee? We can make that available, but it really, again, we really did a broad swath, a broad lens at looking at who could serve as ambassadors. So, for example, there's people from Chicanos por la Casa. There is a group from a representative from Native American Connections. The county health departments are represented. The clinics, the Arizona Alliance for Health Clinics. John McDonald will get mad at me if I don't get that name right.
The United Way.
United Way.
AARP.
So it really is a variety of members. We've had about 20 to 25 people We've got representatives from the health department. We have a representative from the governor's office, insurance organizations, so hospital association. So really looking at, these were designed to be ambassadors to get the word out and to bring their perspective in to help make this a more robust process.
Another approach that we took was thinking about the steering committee as a hub and spoke group. In other words, we reached out to associations who have large networks of folks that participate with their stakeholder groups, so that by leveraging, for example, the AARP, we're expecting that the AARP will then branch out to their network of stakeholders to get maximum outreach through that hub and spoke method. So when you go to the website and look at the members of the steering committee, you'll see that in general, most of them are representatives of large coalitions that have a broad array of stakeholders from a number of different disciplines.
Yes. Another question. How are community members able to give input to this process? If you go to the website that's on the ADHS Managing for Excellence website, you will be able to give your input right there. DHS also has social media capabilities, so you can get on Facebook, you can get on Twitter, you can get on Instagram. So there are a wide variety of ways that you will be able to participate in this process.
And you can join a work group.
Yes.
Probably the most important thing that you can do if you really want to take a deep dive, and if you really are able to put some time into it, we'd like you to volunteer for a work group, because the more robust our work groups are, the better we will be able to put together both the set of existing services, the gaps that we have, and ideas for doable interventions.
The other thing you can do is take the link and send it out to your colleagues and your network, so that you make sure everyone you know that might be interested has information. They can see a playback of this recording. They can look at the state health assessment. They can look at the priorities. They can participate because you've reached out and made sure that they were able to give information and take advantage of this process.
Okay, let's see. Here's another question. Why isn't access to primary care not a clear goal?
I think if you look at, if we go back to look at the list, access to care is really one of the primary ones, because unfortunately, although access to primary care is very critical, access to specialty care, particularly in rural areas, is very significant. I know I have friends that live in Prescott, for example, and it's very difficult to see a neurologist or to see cardiologists in that area, because there are so few specialty care, or subspecialty care in some cases. So you really want to take advantage. We wanted to cover both.
But when you look at the objective around access to care, really a big chunk of that is access to primary care.
And it clearly starts with primary care. That's been the focus. And looking at that primary care from a variety, it is not just doctors anymore. It is well clinics. It is the commercial clinics now that are available to get your basic immunizations. We're seeing that in other states, the scope of practice of some providers has changed in order to provide some of those well care visits in a variety of ways. And I think nationally, you're starting to see that, and I think you're going to see even more of that in Arizona as we evolve.
A good example of that is the emerging role of paramedics and EMTs in that primary care role. It's something that we are calling community paramedicine. There's a lot of interest in the fire districts and with the EMS and fire services across the state to really expand the role that EMS and fire play in that baseline primary care role to make sure that people stay healthier in their homes and avoid unnecessary hospitalizations. And so that's just another example of thinking creatively about access to care. Like you said, it's not just about adding PCPs. It's about looking at the assets that we have across the state and leveraging those to help achieve the goals of primary care. One of those examples is community paramedicine. So I think that, good question. So this, you want to do this?
Next question, how does housing fit or intersect with any of your planning? Again, when you look at healthy communities, how housing can play a great role. I can give you a clear example. When I worked at St. Joseph's Hospital and Medical Center, we did a community needs assessment looking at the data and the zip codes around St. Joe's, and we found one zip code in particular where there was a higher incidence of asthma, particularly asthma in children. And it literally, when we drilled down to see what was going on, we found there was basically one apartment complex that had a higher incidence than anywhere else. And so you start to look at what is it about that housing complex that forces people to go to the emergency room or have additional doctor visits. And at that point, many of them were uninsured. And so it led to greater uncompensated care, and it was close by St. Joe's. And so we began to look at that, and there were issues related to excess dander, there was issues related to mold, there were health-related issues in that housing unit that started to cause problems. And when we addressed those issues, the health issues started to reduce. And so just as a hospital can do that, we want to look at that. And there's a concept that more and more people are using called health impact assessments that really looks, and many cities are starting to do this. We've done it, helped St. Luke's Health Initiatives, helped with, I think, ADHS and the city of Phoenix even, looking at one for a housing unit, a housing development in Southwest Phoenix that was being retrofitted. So federal dollars were used to help shore up and improve the quality of the housing, which directly led to health benefits. So I think you will see that incorporated in that healthy communities and the objectives, because housing absolutely, and national data shows this, that housing absolutely does play a role in the health of people.
Thanks. Good answer. So one of the next questions is, will there be any grants to help propel this health improvement plan forward? Probably yes and no. One of the things that we want to do in the State Health Improvement Plan is to leverage existing resources to make sure that we're using them in the most effective way. So I'll give you a quick example that is related to primary care, since we just covered that, or healthcare, access to care. One of the bigger issues that we have in the state is lack of primary care in the rural parts of the state. And so one of the bigger challenges is to get clinicians into those rural areas. We do currently have a loan repayment program within Department of Health Services that's funded in various different ways. But as part of this state health improvement plan process, we've identified that the statutes that exist right now aren't crafted in a way that maximizes the use of those existing resources. And so one of the things that we expect to come out of the State Health Improvement Plan are suggested modifications to the state laws that surround loan repayment. And that way we can drive those currently existing resources in a more effective way to get the kinds of clinicians into the rural parts of the state and more effectively. Another example we covered earlier was around the trauma system. So there's Indian gaming money that comes into the emergency departments and level 1 trauma centers here in Arizona. The way that's distributed currently is 90% of the money goes to the level 1 trauma centers and 10% goes to emergency departments, with nothing going to level 2, 3, and 4 trauma centers. That's an example of something that we expect to come out of the State Health Improvement Plan, is to propose modifications to that distribution formula so that we have incentives to build out that rural component of the trauma system. So those are two examples, not of increasing resources and increasing grants, but rather redirecting and making adjustments to currently existing programs. Another thing that we should probably cover here is that often there's a mantra in all levels of government that we need more money to do better, which often isn't true. Sometimes you need policy changes that help you execute your programs more effectively. And I think that's some of the things that we expect to come out of the State Health Improvement Plan, not all in the classic public health sector. A lot of these will be suggested modifications and templates, for example, for cities to use in their general plans that go in front of their voters that include a health component that has policy changes in zoning, et cetera, to help drive communities to become more healthy environments so that people can make better choices. So it's a combination, I think, of policy adjustments for reallocating currently existing resources and then identifying evidence-based policy changes that can be made in a whole host of sectors that will drive better results over time. And so I think it's a mistake to think that we are going to need a lot of additional resources. A lot of this is designed to make sure that we're most effectively using the resources that we have. And if we get additional resources from some source by showing that this is an excellent process that's improving outcomes, then that's great. But we're not doing this to get more money.
All right, another question. How do we give feedback on the goals and priorities? As we said, if you go back to the last slide, you can go on to the Health Improvement Plan. There's a direct place on the link on the website that will say feedback on flagship goals and priorities, and then please complete. It's a very simple survey. I completed mine and gave information about that. So that's really where you can have the most impact. And we really want not only for you to do it, but we want you to distribute this to your friends and colleagues so that everyone has a chance to really make a difference and to get that impact. We really need to develop that inventory and to get that sense of what exists. We need your advice on gaps, and so we have some sense. And so the work groups can really focus on, let's not reinvent the wheel, let's take advantage of all the good work that is going on in Arizona, but let's look at those gaps and develop policy initiatives that really address those gaps.
So the next question is part of a statement and a question. Great to see the healthy communities as a flagship goal. For those already working on healthy communities in a way that doesn't fit into the work groups, how can they participate? Let me reframe that to say pretty much all of the 15 priorities fit into a healthy community flagship goal. The question is, what's your level of interest in self-identifying for one of the work groups? And one of the ways that we are trying to help you make a decision about what work group to join is when you go to the SurveyMonkey, there's a series of questions that we ask before we ask you to self-identify for one of the work groups. And those questions are designed to help you think through where your real interests lie, because pretty much everybody does better in an area where they have a lot of passion. And so what we tried to do is to make the SurveyMonkey help you identify what those passions are so that when you get to the question around what work group should I join, it'll be intuitive for you, because you say, well, boy, I answered the question around physical activity, nutrition, higher on the scale than some of the others, so let me jump in there.
The other thing is, if you see gaps, if there's something in that flagship goal or the work groups that doesn't fit and you think something's missing, we want to know that too. Because maybe in the end we decide we need to create one more work group or something, or make sure that a certain work group covers different things. But that's your chance to give us information to let us know where you think those gaps are. So I would encourage whoever asked that question, if you think it's missing, we need to know that.
You want to do this one?
Okay, what physical healthcare is so disjointed, will care management be utilized? I think absolutely. We've seen this time and time again in Arizona, particularly some of the hospitals and insurance companies have done some very innovative work on care management. We've got a number of accountable care organizations, several very good examples of patient-centered medical homes, and really being able to improve the quality of care, outcomes are improved, and cost is reduced. And over and over again, we've seen nationally, and there are some great examples in Arizona of where this care management integration of care with social services, and again, not just dealing with the physical health of patients, but are they home and they don't understand how to take their meds? Do they not have transportation to get good food? Are they missing their doctor's appointments because they don't have adequate transportation? All of those kinds of things can lead to poor outcomes and less quality of health if we don't have that care management. So I think we need to take advantage of, there's just truly some very good examples that have been going on all over the state. So we need, but nowhere have we really inventoried them and sort of helped even talking about best practices. So I think through this process, we will be able to achieve that.
The next question is, how are you planning to incorporate the more clinical programs like immunizations, family planning into this plan? I think it's included in access to care, but I think this question highlights the importance of getting involved in the work groups, because one of the ways that the primary way that we're going to be able to identify effective interventions to improve outcomes in each of these areas is to get ideas from the community around A, the existing resources, and then B, the ideas that you have to help us mobilize to improve our performance and outcomes in each of those areas. So I don't have a clear answer for that question, except to say that's an important segue to like why whoever asked that question should get involved in the work plan, because we need the answers to things like that.
Absolutely. Okay, how can or will Arizona incentivize specialty providers to relocate to areas that are labeled as communities of low socioeconomic status? There are other states that have done a better job than Arizona about this. And there's a variety of programs that have helped incentivize. In one area where Arizona has done a good job is what's called the WICHE program, the Western Interstate Compact for Education. That for a long time, Arizona didn't have programs like veterinary medicine and occupational therapy. They didn't have programs at the public universities. So they set up a program literally in the 50s where if somebody went out of state, as an Arizona resident went out of state to get a veterinary medicine degree, for example, and then came back, their loan was either reduced or they could repay it. And it was reduced even further if they were in a rural area or, as you called it, a low socioeconomic status. And so there are those kinds of incentive programs, but it was only about 6 programs that were involved because they were things that weren't offered at Arizona public universities. That has now changed. You've seen some press, probably. Veterinary medicine is now going to be offered at University of Arizona. I think it's also offered in some vet tech programs are offered at Midwestern. So that landscape is changing, but there are ways for us, and the other states have done these kind of either loan forgiveness or loan incentives to go work in rural parts of the state.
Thanks. So another question is, how do people sign up for the work groups? That's simple. At the beginning of the presentation, there's a link that shows, and at the end, of how you can go to the SurveyMonkey, and that SurveyMonkey is going to go through a series of questions. It's going to ask you to fill out. It's really quick. It just takes a few minutes. And then at the end, it provides you an opportunity to volunteer for one of the work groups, and then give your contact information, and then our team lead will get in contact with you for when those work groups are going to get started.
It also gives you a place to say, who do I know who needs to be involved as well? So you have that ability to not only put your name and contact information, but to recommend other people that we can follow up with.
I'll do this.
How will the work coming out of the different work groups be coordinated to ensure efforts aren't being duplicated? I think that will be the work of the Department of Health staff and the steering committee, really looking at, as that work, where are the intersections, where are the collaborations. Again, it's hard to look at these just completely in a separate silo, because there are so many intersections. Where's the intersection of diabetes with obesity, and smoking with lung cancer, or that kind of thing? So we'll look at where those, and what may happen is a series of initiatives and strategies that are cross-sector. And so we'll end up doing that as we put together those strategies, acknowledging that a single strategy may have multiple benefit for multiple issues. And then how will the work group stay informed about the efforts of the other groups? That is the miracle of the internet. And I think we'll be able to continue to make all that information public. And that means that even if maybe you are interested in 2 or 3 work groups, but you have limited amounts of time and you want to keep up, we'll be able to make those work group, the efforts and the work, we'll be able to codify that online and make it available so people can add to it. Because again, this is one of those programs where more information is better, not less. So to really fully get the inventory, to outline gaps. And again, as Will said, this is a 5-year plan. It's going to ebb and flow. It's going to change as we get involved. Our hope is that we could go to a new governor and a new state legislature and say, let us brief you about this. Maybe your funding priorities might change, or that we modify things, or we encourage collaboration among state agencies, so that the housing department is working with the Commerce Authority, which is working with DHS and working with Access, almost like you could have a health cabinet in my perfect world, where the leads of these departments would be working more interagency. There'd be more interagency collaboration.
Thanks, Suzanne. That's the end of our program, if you will, and we're out of questions. So the call to action right now, before you completely log off and go to a different task, is to go to the questionnaire. It just takes a few minutes, and then the most important part of that is signing up for a work group or identifying other folks that need to be on one of these work groups, because again, the way that we're going to build a robust and effective plan is to include the folks who know what those resources and gaps are, and importantly, are familiar with evidence-based practices that work to improve public health outcomes. Thank you.
We really appreciate you taking the time to participate in this, and your work has just begun. So thanks very much.